KwaZulu-Natal continues mopping up after the devastating rains and floods. Over 140 people have lost their lives and scores are still unaccounted for. eNCA's Nobile Madlala joins us now for the latest. Nobile, when we spoke a bit earlier, you touched on the impact that the floods have had on primary health care around many communities. Has the minister, in fact, begun perhaps to be briefed on this matter, or even has his walkabout begun?
Well, from where we're standing now, we've seen the minister arriving in Prince Mshiyeni Memorial Hospital. He's gone inside with the deputy minister as well as the MEC of Health. We've seen them go inside. They're doing the walkabout. As we understand, they are going to be briefed with regards to what has happened in the hospital and how it has been impacted. We know at this point that the impact that has been felt by the hospital is mainly because of the water infrastructure that has been swept away. Earlier on, we were talking about the fact that KwaNgqolosi, over 25% of water supply had been disrupted there because of the water infrastructure that was swept away in that area. And of course, we know that that area also supplies eThekwini municipality, which is where the hospital is currently situated at. But what you see behind me, some of the people that are patients that have come to the hospital, and you can just see already that there's quite a number of people, even in the waiting room. You can just see that there's quite a number of people that needs to be attended to. And of course, we will hear later on from the minister in terms of what is going to be the contingency plan for all these areas that we understand also are experiencing a bit of water issues. I mean, we heard from the Water and Sanitation Department that was saying that this is, of course, very difficult for them, having to work over the night, right around the clock, to ensure that there is enough water supply to these areas that are affected. And we're talking about the domino effect that is currently happening on the ground. I mean, we know some of the people have ran to get help in the hospitals because of the floods. I mean, we heard from some of the families that have spoken to us. I mean, when we were in one of the areas in Inanda, we heard from a family that was saying that they're grateful that some of their members have survived the floods, but most of them needed medical attention. So you can just imagine how many families need that medical attention. A lot of them saying that they find themselves in hospitals and there's a lot of people in these hospitals. I mean, one of the ladies was detailing about how her aunt and her uncle was basically affected when the wall fell on top of them, and they were talking about the fact that they need more attention, but some people had even been turned away. That is, of course, according to that family that was saying that they need more assistance. So you can just imagine the demand there is for medical service in the province. And of course, that's what the minister is trying to address here. And there is a hope that as the president has declared this a national disaster, that there will be some assistance that will come into the province and will make things much easier. I mean, when we're coming here, even the roads are difficult just to drive on them. It's difficult to get anywhere. Some people haven't even gone to work. We know that some of the staff in these hospitals are even now staying in some of the hospitals. They're being accommodated in areas like Mahatma Gandhi Hospital because some of them also have been impacted in their homes as well as their relatives, and only to have to come back here and still assist people that are impacted. So you can imagine also the emotional trauma that everyone is going through, as well as the staff that has to also still carry on and work despite having also that domino effect where they also impacted on their personal level. And of course, what we're seeing here, of course, is what the minister is going to be hearing from the hospital. We will hear more in terms of what sort of assistance will be provided to these hospitals and what will happen going forward. But we do know right now that the minister is inside the hospital. He's doing the walkabout, and he will be hearing a lot more about the impact this has had to the hospital and the nearing hospitals in eThekwini, as well as the other municipalities that we know are currently affected in the area.
No, we must certainly await that briefing after the minister has been briefed himself. But it will be important to hear how they plan to capacitate clinics, Nobile, because if they're to perhaps relieve the hospital currently of the number of feet, they need to then capacitate the clinics in various communities to at least attend to the minor injuries that one would presume?
Well, definitely, Nomfundo. Quite interestingly, some of the areas here, and I know areas like Hammersdale, which falls under eThekwini municipalities, some of those areas actually have clinics that work around the clock, which is 24/7, 24 hours, 7 days. And we know that those clinics generally tend to attend to some of the people that are in the area. So some of those clinics will come in handy now because we know that they are able to do that work. But of course, there needs to be a way that people can be helped and that they can't just be rushing to one area of assistance. I mean, we heard from Zandile Gumede, who was also calling out on community members, saying that people must stand up and assist each other at this point. So you can just imagine that they're also asking for everyone to assist the best way you know how. We went to the north of KwaZulu-Natal, where we also heard that even the churches were also pulling in as well, trying to assist things like emotional trauma, where people can actually call those lines and get some counseling. We heard from even that church that was saying that you can get counseling in certain numbers. People can call those numbers to just get some counseling. I mean, we heard also yesterday when we were speaking to some of the community members in Gwandengezi, and they were talking about the fact that it's very difficult for them to move on when you have people that are hurt, you have people that are going through mourning, really, that are mourning the death or the passing of their loved ones, and at the same time they need to fight for basic services. So it's a lot that the community needs to deal with at this point. So it would come in handy that also these facilities are able to assist these community members, because this is indeed a difficult time for many people. I mean, we've seen the rise in the number of deaths of people that have been found to have passed away, and there's still some communities that are still searching. So you can just imagine the effect this has had emotionally, mentally for many people, also to come here and not get the assistance right away. So it just adds on that emotional trauma. So there is really a need and a hope that the walkabouts that the minister is doing will come up with solutions for people that need assistance urgently.
We most certainly hope so. Ngobile, we'll leave it there for now. That's our reporter Ngobile Madlala out at the Prince Mshieni Memorial Hospital. Now,